Welcome to Healthy Habits Podcast. In this episode, I meet with the physiotherapist Karol Szapel. He has over 17 years of experience as a clinical physiotherapist, and his special interest is acute and chronic pain treatment. He is an active proponent of evidence-based physiotherapy, and in his work he cooperates with many renowned specialists in order to fully understand the underlying problem, this way going beyond the standard work of a physiotherapist. Karol Szapel is also the director of Polish Association of Invasive Physiotherapy and an active educator. He has organized more than 300 trainings, seminars, and workshops in physiotherapy and osteopathy, and he presents the results of his work on scientific congresses. He is also engaged on social media, where you can find him promoting good practices in the work of a physiotherapist. Today, our discussion will center around the concept of health within the realm of physiotherapy. And Karol Szapel will mention the circumstances under which one should seek consultation with a physiotherapist. We will also discuss evidence-based physiotherapy, and we will explore the methodological framework essential for sound physiotherapeutic practice. My guest will also tell me when and not to trust my physiotherapist, and he will share his opinion and scientific facts behind the very popular osteopathy. The wealth of knowledge possessed by Karol, coupled with his admirable willingness to share expertise, is truly inspiring. Are you ready? Tune in with Healthy Habits Podcast. Hi, Karol.
Hello.
We meet 3 days after Christmas. Tell me, are you back at work, or are you still at home celebrating?
No, I've got 3 days till the end of the week, and just after the New Year party, I'm going back to work.
Okay,
so free time with my family.
From what I know, you work mainly in the field of so-called evidence-based physiotherapy.
We can say that.
Could you explain what is evidence-based physiotherapy?
Evidence-based physiotherapy is a model of providing physiotherapy treatment based on 3 pillars, of which one is the most important, which is the evidence which we have from science. And then we have experience of the therapist, of the specialist, which is based mainly or is coming from experiences working using evidence. And there is, of course, also patient expectations, which we have to get into the process and fulfill them somehow.
What do you mean by evidence?
Good question. If we have a problem, this problem has to be somehow defined. And if it's defined, we have to know what kind of stressors or what kind of physical agents in physiotherapy can make it working better or worse. So what I mean from evidence is what was checked by more objectively than subjectively.
Mm-hmm.
So what was checked?
So do you mean in order to, maybe we can think of an example. So someone comes to you. He says that he has, I don't know, a neck pain. Mm-hmm. So what would be the evidence of this neck pain that one would have? Is his pain not enough? Do you need something else, something more?
No, because we've got very different mechanisms of pain, and because of the mechanism, we will choose different options of treatment, and which will give us more effective and more safe progression.
Okay. So if pain is not necessarily enough, then what kind of tests would you do? By evidence, do you mean some, I know, X-rays or fMRI, so these kind of imaging procedures?
Okay, I understand.
Or do you mean some other kind of tests?
Oh, we use different options. So the most important is interviewing. So medical history or health history. So there are plenty of things we are asking, and we are trying to understand how did it begin, what was the causing factor, perpetuating factors, what is the clinical pattern of the patient situation, what are the not only biological aspects but also some part of psychologic and sociologic aspects of the problem. And then based on the clinical interviewing, we are planning a clinical examination. Those are mainly some kind of tests which we are doing. So like motion tests, special tests, stability tests, vascular, neurodynamic tests. There is a plenty of different clinical tests which we are trying to rule in or rule out some aspects of the problem. And based on that, we are looking into the medical imaging. So what you said, X-ray, MRI, CT scans. We are looking into that or taking a patient or asking patient to do them. At least some of them. As physiotherapists in Poland, we cannot prescribe all of the medical imaging, unfortunately. But in my clinic, it's not a problem. Laboratory tests like blood tests. And then based on all of those informations, which are somehow some kind of evidence, we are trying to put a diagnosis. And as a physiotherapist, we are trying to rule out dangerous pathologies, which we should not be a priority to treat. And then we put a structural hypothesis. So what is a structural problem? Or what is the problem from structural perspective? And then we put a functional diagnosis. So what are functional problems? And this is what we work with the most. And the second is biological. So how we can physically facilitate the change.
It sounds very complex and complicated, I think. There are a lot of different factors,
It's
right?
not complicated. I think the most funny thing is the more I can tell by myself only. The more I learn, the more I teach also, the more I work with patients, the more simply, I'm so sorry.
Anyways,
I put it off and indeed it worked.
no worries.
I'm very sorry. So one more time. So from my perspective, the more I learn, the more I teach, the more I work with patients, I try to work more simplistically. So keep it stupid simple. For me, for my patient, but I see that I had to understand or try to understand how complicated human being is to keep it simple. So I do not follow very complicated things because we don't understand them. So we cannot base our treatment on those because it's false. We don't understand them. It's only some kind of explanation we are trying to put to ourselves and to our patients to make them believe it works and so on.
You've mentioned that you also take into consideration the psychological or sociological factors when you're trying to give a diagnosis.
Yep.
That surprises me. What kind of psychological or sociological factors can you take into consideration as a physiotherapist?
The main things which physiotherapists should take is primarily kinesiophobia. So it is one thing. Another thing is self-management. So how people can self-manage themselves with the pain, with the problem. So that's the second thing. And the third thing is mainly much broader than only sociological, but it's how much the patient has factors which would say there is an anxiety problem, there is a depression problem. So we are not diagnosing that. We are not educated to do that, but we have to know that there are those factors because they are making our work and patient work difficult, especially with pain.
Okay, so for example, if someone is suffering from depression, then it might impact his recovery or the diagnosis. So what I mean is, can my pain be caused by, for example, my depression, or do you have to take depression into consideration? Because if you give a certain treatment, it might not have a positive result because someone is in depression.
The second one.
Okay, I see.
Okay. But there are people who are saying that depression will give you pain, what is not supported by science, especially itself. But it's like you said, the second thing. Okay. Second, the model.
And what do you think about the fact that people that perhaps depression may cause pain? Do you think it's possible, even though it's not scientifically proven? Do you think it may be possible?
I think it can be possible, but we don't see strong evidence it is doing that. You know, the problem is that pain is very complicated phenomenon. It is not, people sometimes, maybe some people think it's just some kind of sensor in our body or sensors which are turning on and the cables are following to the brain and then we feel pain. No, it's not. Pain has many dimensions. Pain doesn't have strictly one or maybe defined brain center or a medullary center. So there are many dimensions of pain.
Could you explain on a physiological level, how does pain work? When do we experience pain?
Wow. Okay.
I mean, if not, then I understand, but
that can be difficult. But generally speaking, pain is sensational and emotional feeling. Let's call it like this, which can be a cause of real or something what seems to be provocative or injuring us, or is thought to do so. Okay?
So you mean that I can think that something will provoke pain, and this is why it would provoke pain?
Yeah.
Mm-hmm.
But still, it can be a very short pain, acute one. But when we go into the patient's problems, where we deal with not a short acute pain, or maybe, okay, we do deal with it, but the problematic one is the chronic one. So we can say the pain can be physiologic and non-physiologic. Chronic pain is somehow non-physiologic. We don't need that for survival. It is causing dramatic changes which are not serving our survival. So from perspective of acute pain, that's okay. All of us feel sometimes some pain, higher, lower, the acute one, which goes away. But some people evolve chronic pain, which is now understood as a disease itself. Doesn't matter, is it it has some comorbidities or not. So, so first thing is you can feel pain when you touch something hot or something very cold or something very sharp, or you injure your finger or your joint, your muscle, your ligament, whatever. But this pain will go away as soon as the biological processes there will cure the problem. Cure, regenerate, rebuild, remodel the tissue, and so on, so on. And we've got times for that for given tissues. And if something is going longer, we start to check if there is a problem on the biological level. And very often, there is some kind of problem. But it's not enough for the patient to feel so high intensity pain.
So if I feel pain in my body,
Mm-hmm.
when should I consult a physiotherapist? How can
Mm-hmm.
I know if it's just an acute pain that would go away, or
Mm-hmm.
if it's a more serious issue that I have to consult with a physiotherapist?
I would answer on that: as soon as you feel, you should do that.
No matter if it's acute pain or chronic pain, if I have no idea, I should still go and see a physiotherapist.
Yes, as soon as you feel, you should do that.
And
Okay.
yeah, but then it's really subjective. I mean, some people would probably go sooner and others would go later.
Yes, that's true, because there is no objective answer that, yes, if you feel this and this pain, you should go ahead. And if you feel this and this pain, you should stay 3 days and then go to physiotherapist. It is too difficult to give simple advice which people will remember. So if you see that your state is getting, you feel very stressful, or is getting you feel uncomfortable daily, I mean, you cannot do some things you would like to do. We are not talking about, bone injury, or total macro muscle injuries, because those states will make you go ahead to hospital. I'm saying about situations where there was no direct injury and you start to feel some pain, some discomfort, some pain. So if you feel that you cannot manage it yourself, just go visit a specialist, a doctor, physiotherapist.
And when should I see a doctor and when should I see a physiotherapist?
Good question. I think it's good to visit both. It's very. I always try to be honest, and I think it's a very how to call it, personal thing. I mean, it depends not on the medical education you have, also, but not itself. It relates to how good the specialist is in assessing a patient and deciding this should be done by physiotherapists. You are safe. No, you are not. You should visit a doctor. And the doctor should know when she assess a patient that it doesn't need any surgery. You don't need any pills, any pharmacologic treatments. Go visit a physiotherapist.
Does it happen? I mean, because you work in Poland. So in Poland, do you think that how often is it that doctors tell the patients to go and visit a physiotherapist?
Mm-hmm. I don't know the statistics. I think rare, generally. I think that's my opinion. But from my experience and working with medical doctors I'm working and co-working with, very often. I mean, that's the foundation of our cooperation and building medical teams. So it depends where. This is what I said generally. That depends where you're looking for help.
And then from the other side, so if I don't feel any pain, does it mean that I'm healthy? Would you say that just not experiencing pain is a guarantee that I don't have anything that I should consult a physiotherapist with?
Pain is not the only thing we should consult with medical specialists. So if you have any functional problem,
what do you mean by a
lift my hand higher, okay? I cannot move my body so fast somewhere. I feel sticky somewhere. I feel stiffness. Those are things which are not really pain, but they are making difficulties for you during your daily living. So those are things which you can consult with physiotherapist. But I'm on the side because it depends it depends on with whom you are talking to. So my opinion is to medicalize somebody as minimal as it can be.
So only consult someone if you really have to.
Yeah.
So you don't think that physiotherapist can also be looked as a mean of preventive medicine? You think it's only...
Oh, yes, they can. But this is not treating, it's prevention. So preventing, I would say physiotherapists would be good in prevention, mainly from educational point of view. So they should give some advices how to start being active, for example, from the safety perspective, from the health perspective, from the functional perspective. So if somebody wants to start being active, okay, I don't know, running, climbing, bicycling, whatever, a physiotherapist can advise how to do it safely. The main problem now is that many people which are starting to being active, and they were not, or they were on a very low level, and suddenly they want to be on a very high level, they are doing it too quickly. And that's the main problem.
That's when they can have some serious injuries.
More or less serious, yes. Yes.
Is there such thing like a red flag pain? So are there any pain that I should consider red flag and that I should definitely consult a doctor or a physiotherapist?
Yeah, for sure. It's first of all, it's very intense pain, but nobody thinks we should not. So it's normal.
It's obvious.
But any pain which does not go away. So I mean, it's very constant. It doesn't matter what you're doing. You're lying, you're sitting, you are walking. Doesn't matter what you're doing. So mechanically, not provoked mechanically or not changing during prone supine positions.
And then if I am physically active and I do not have any chronic pain, but I'm still a bit worried because I just use my body a lot. So I know I practice sport maybe 3 times a week or 4 times a week. Then should I consult my physiotherapist in a preventive way then to see things?
I will ask you now. So that's what we've been talking about 5 minutes ago.
Yeah.
Why we are afraid of? What you are afraid of?
Why would I mean, you mean why would I like to consult a physiotherapist? What am I afraid of in terms of my physical abilities?
Yeah.
I would say that I'm afraid that I will not be as physically fit, for example, in 20 years from now. Because if I use my body too much today, or in a bad way, if I practice sports too much, then in 20 years from now, my body won't be there for me.
Okay. So you will overuse it.
Yeah.
This is if I understand it well.
Yes.
Yeah. Are you overusing it?
I don't know.
Okay. And how can you get to know that?
I don't know. I should run some tests, maybe.
Maybe, yes. Okay. What about your regeneration?
Okay, so I should consider how many days do I spend without any physical activity.
Maybe not days, maybe how you sleep, how you eat, how you drink, how you enjoy your life and smile. I see you're a very smiling girl. So I don't see a lot of problems now for that. At least I don't feel that. But those are questions we are asking. So you've got some construct in your mind that if I will overuse, I can have problems in 20 years. Yes, no, we don't know. Okay? Remember that many problems of musculoskeletal system, because I'm a musculoskeletal professional, not neurological, are in your genes now. How can you change that? You cannot. So you can only control things which are somehow controllable. So the most important thing is to do not overuse yourself. That's true. So when you go to training and you feel you're exhausted, you are tired, or you are during the training in the middle of it, and you feel that your right hand, you're climbing, yes? You're climbing.
Yeah.
And you feel your right hand is, there is something wrong with it. Just listen to that and regress the intensity. I don't mean finish. I mean, or stop. I mean, regress it. Go down, do some other workout which will help you with climbing, but do not use your hand as much because it's already telling you, leave me alone, I'm tired.
Okay.
So basically those are important things. And if you are tired, you should not train as hard as you can. Okay? And many people do not listen to that.
Yeah, because also very often they want to achieve, right? So you want to achieve.
Yeah.
And you don't want to.
Then we've got six months pausing because of the contusion or I mean the injury. Yeah.
Yeah, especially in climbing, there's so much injuries in climbing. I have many friends who had serious injuries, and then you're like 1 year without practicing any kind of sports, actually. So
very often it's too much in a short time, which you are not adopted to do or to withstand. Yeah.
Do you think that there is something like being healthy? I mean, for you as a therapist, who is healthy for you? Is it that every person has some kind of a problem in their body? Or do you think that there is someone who really literally has no issues whatsoever because he's always taking care of his body, and so there is no work for you?
No, of course there are people which absolutely do not need my consultations and my work.
And who would that be?
Sorry?
Who would that be? So, because I think we all have some pain from time to time. We all have some stiffness from time to time. Yeah. So who do you consider a healthy person as a physiotherapist?
Who can manage himself or herself without help or external help. There are people who are managing themselves very well for a long, long time. I don't mean never. I mean for in many situations, they can manage themselves very well. Mm-hmm. Being honest, I'm not a healer. Okay?
Yeah.
So I'm trying to give some advices to progress and regress some things, give some stressors or manage the stressors where his, her, yours body will do the job, not me. So I'm not a healer. I do not put my hand and making any kind of problem goes away, because I will rub it, click it, crack it, massage it, needle it, whatever. Okay? So I'm not a healer. It's really important thing, and I don't think there are healers.
Mm-hmm. And you've mentioned various techniques of work, so needling or massage. And there are many people, I think, who think of physiotherapists as of people who do massage. What's your view and your opinion on that? Are you mad when someone calls
no.
you? Yeah.
No, I used to that. No, I'm not. I don't care, being honest. We are what we are. The problem is where somebody, how our profession is promoted. That's the problem, because for many years, we've been those guys who put the hand move a little bit and massage it and so on, so
like
on.
a magician. You touch and healer.
Then, yes, exactly. Then we've got all of those passive treatments, passive modalities, which are okay. They are useful, but this is not the whole physiotherapy. So people think we can touch somebody and make it heal, or we can, as I said, rub something, compress something, stretch something, and it will help. Mm-hmm. Yes, it will, but in many cases, it is not per se. I mean, the effect is mainly in patient's mind, how they. It's difficult for me to explain that in English, but it depends on how your brain or your mind, not the brain, your mind, see your body. So we can change it for many, using many different things. Mm-hmm. Like, it's not only physiotherapy. You have people who are meditating. You've got people who are going into very cold water or climbing up the mountain only in their panties. Okay, and they feel better. That's fine. That's fine, and they feel better. Okay, much better. It is changing their life.
Yeah.
It is not the specificity of this thing.
Mm-hmm. So you come from
uniqueness of the feeling and sensation and emotions which were there, which are changing you. And the same is with physiotherapy.
Yeah, so you come from a place where if it works, if you're feeling better, if your body's better, then it doesn't matter if it's a massage or if it's needling or if it's another kind of therapy or if it's taking cold showers. That for you, whatever works, whatever is good for you, you should do it.
That's fine. You can do it. But remember, it doesn't heal you.
Okay.
That's the important thing. We don't know where very often, but there is a line between feeling better and healing.
Hey, if you're still listening, that means that you enjoyed this podcast. We love sharing with you, speaking with our guests, and we are happy to bring all this information to you for free. However, if you like what we're doing and you wish to support our work so that we may keep developing this project, visit our website, hhpodcast.buzzsprout.com, and click the support button to make a donation. You can also follow us on Instagram or subscribe us on YouTube. And don't forget to share our podcast to a friend or a family member if you like it. All the links are available in the description of this episode. And now, back to our conversation. Yes, that's something that I wanted to discuss with you also. So how can I know if I'm getting better? Is it possible to because we have objective measures and we have a subjective feeling. How do I feel now?
And subjective measures.
Yeah, subjective measures. So
patient-rated outcomes measures, PROMs.
So which one do you think we should trust?
Both.
Okay. Is there one
important?
Is there one that you think is more important? The objective measure, for example?
No, I don't think so.
And if I go to my physiotherapist, and then I'm like a couple of months into treatment, but I don't see any results, should I be concerned?
Now the question is to your team, to your therapist. How do you measure the progress? So there are diseases and problems which do not show automatically progress to the patient. So one of those things are tendinopathies and enthesopathies. They are not getting better so fast as we would like to.
Could you explain, just for those who don't know, what is a tendinopathy?
It's a let's call it a disease or painful tendon or attachment to the bone. So tendon attachment to the bone. So depends which part we are talking about. It's tendon or enthesis. So we can talk about tendinopathy or enthesopathy, which means pain and dysfunction of the tendon or the attachment of the tendon to the bone. Yeah, very simply.
Yeah, so you were saying that they don't heal as quickly as you would like to, or that you don't have any.
Now it depends what the problem we are dealing with, and this is evidence which are telling us that some kind of those problems which will take time.
Okay.
And you cannot expect it will be like this.
Yeah, just go away.
But it depends what the problem or what kind of problem do you have.
Yeah, as always.
And this is again evidence, because we have to assess that.
Okay, because I thought that if you talk about evidence-based physiotherapy, and in general, if you talk about evidence, then you only consider objective means. But you do take into consideration.
Absolutely not. Yeah. I think I make more measurement, patient-related outcomes measurements than objective ones.
Okay.
But it doesn't mean I always trust only those. I mean, they are not, maybe not trust. Trust is a wrong word. I do not base my or put my treatment process only on PROMs. Why? Because there are other biological things which are much more objective, and they are connected with better treatment effects. So, for example, with tendinopathy, Achilles tendinopathy, so that big tendon just above your heel, if you've got a problem with it and it stopped, the pain goes away. Okay, so you don't have pain there. And the patient is happy. I'm healed. I'm healthy now. You feel like that. But your tendon, for a very long time, after those 1, 2, 3 months of treatment, is not ready for some kind of actions you will put it on. So when you treat your Achilles and you regress your physical activity, your tissue is adopted what 2 levels of physical activity which you've been stressing it. So for last 4-6 weeks, okay? So when you end up and you stop to feel pain and you end up the treatment after 2 months and you go back to running, for example, or you have a hamstring problem just below your ass, okay? And you're a climber and you're putting your heel very high to get the grip there, okay? It is very, very possible the problem will come back.
And then I also have many friends who have a problem and then they think that they heal this. So they consulted the physiotherapist or like now it's better. But then, I don't know, 1 year later or 2 years later, they start to have a problem. Like, I know it started with their heel, but then it falls into their knee or to like other parts of their body. So do you also observe that very often that people have, like, if you don't heal the injury that you have 100%, then it might transform itself into another kind of injury in a certain part of your body?
I will try to be here very... I will take a distance here, okay? I don't want to say that if you had this problem here, that makes you will have a problem there, and that makes you will have a problem somewhere else.
You're not a fan of this kind of...
It doesn't work like this.
Okay.
So much. So much. Of course, if we have a problem in one part of our body, it is very possible we will try to compensate. So you get, for example, the most simple things. You get weaker somewhere, okay? Your muscle is weaker. So when we move with our whole body in most of the times, okay? I mean, in sports, for sure. So if you get a weaker somewhere and you still want to do the activity, you start to compensate. So you start to move differently to realize the goal of activity. And that's fine. This is how we work. But the problem is when other part of your body is not adapted to withstand those physical activity and an intensity in this very acute change. I mean, sudden change. And I see that much more like this, if at all, because in many cases, it is just, we try to look at technique, we try to look at those specific things, and I don't want to say they are not important. They are, but they are only factors. They are some percentage, this is some percentage of whole reason why something happened.
Okay. So we should not jump to conclusions and just be careful.
No, I don't think so. I don't have them, and I think our evidence don't have it too.
Okay. I wanted also to ask you about scientific studies in physiotherapy. I do not know that much about about the scientific methodology in physiotherapy. I know that you can use, so probably subjective and objective measures, as always. But I've heard that there are some problems, methodological problems in physiotherapy regarding those subjective measures that you have, and also high variability, intervariability between patients and how each of them would react to a certain treatment. Could you tell me if I'm right, if what I've heard is right, if those are the problems that you have in scientific methodology, and what do you think about that?
You come from psychology, am I right?
Yeah, I come from cognitive science, but it's psychology, neuroscience.
Okay, so I think the problems are the same, like in your department, let's say in your part, because we are trying to look for answer or response in human being. The intervention is different. Okay, so I think the biggest problem, I think, is that very often we do not control placebo, or we do not know how big the placebo is in the given group, experimental group. We do not assess it, we do not control it. So from my point of view, that's the problem.
And because why don't you control? Yeah.
Okay, because I would love to know what are the specific effects, not the general effects. effects or non-specific effects.
Yeah, but why isn't placebo controlled? Because normally in psychological studies, very often you do a placebo group, and in physiotherapy you don't. It's not common.
No. I don't want to say in physiotherapy because it's whole world.
Yeah.
Okay, of course we do them, but sometimes it's really, really difficult.
Okay.
So, for example, if you want to blind something in the randomized clinical trial, you have to blind many. How to call it? I'm looking for a word, but many parts or participants generally, people participating in the study. So those are not only, of course, participants. Okay. Those are also operators, so somebody who is providing the treatment, let's call it.
The experimenters. So it might be the doctors, exactly.
Or somebody who is checking it, so the tester, observer, whatever, statistician, main researcher, and so on. So it is difficult to blind a therapist.
Yeah.
How to blind the therapist? It's not the sugar pill.
Yeah.
You are doing something, okay? So you cannot blind therapist, being honest. It's very, very, very difficult. With some modalities, it is possible. So that's the first thing. It's very difficult to blind patients. So I don't want to say we are not doing placebo-controlled trials. Our society is trying to do that, but it is really difficult to do that. But in psychology, how can you blind a therapist?
I mean, it would depend on the study that you want to do, but normally, since very often there are some scripts that are already written, it's not really necessary for a person who really has the experience of a therapist, for example, to do a study. But it all depends, probably.
Yeah, but this person still knows what is he doing.
Yeah, so, I mean, you can give another. I mean, you can make up a story that you would tell to the examiner, and then like the examiner would want to know what's the actual goal of the study. He would only have like some partial information.
Exactly. Okay.
But it depends. I'm sure that there are some cases where it's not possible because you will know what's. What is the real goal of the study?
What you're doing.
Yeah.
Because that's the interaction. Okay? So I don't want to say it's impossible. It is difficult like in your case too. Okay? But we are trying to do that you ask why we are doing it because I think physiotherapy is a medical science. It is within medical sciences, and we want to know what is the specific effect of what we are doing, not only the general one, or because somebody looks nice or is smiling or is empathic. Okay, what is so much important, but it is not what we are very often treating with. I mean, we are using some other modalities, and we want to know how specific they are.
And what about this inter-individual variability? Is it a problem in studies in physiotherapy that each person can react differently to the treatment or may have a different kind of injury and so on? Or you can generalize?
Yes, it is difficult to get well-defined group. Okay, so that's interesting because it depends what we are checking. Okay, for example, if you want to find out, I can tell that based on my experiences in my area. Okay.
Yeah.
So, for example, when we treat and assess tendons, we often have people who has in inclusion criteria and exclusion criteria. There are people with Achilles pain, age from this till this, men and women, no comorbidities, and so on, so on. The problem is very often, and it is really important in tendinopathy, how we checked there are no comorbidities. It is just because the person is just saying it has no others. So how did you check it?
Okay.
So that's one problem. Another problem is that very often we don't have people only with, or each problem can be similar from the structural perspective, but can be very, very different from personal perspective. So what I mean, you can have the same problem with your shoulder, for example, than your friends, okay? It's the same, but each of you has different personal experiences of it, okay? So that makes also a problem, because very often we try to use clinical criteria which are based on very often very structural or only functional things. So I can elevate my shoulder till 90, not above. Okay, that's the group. Okay, so we are very structurally driven, and I think that's the time is changing, and we are changing it now.
Okay. And do you think, where do you stand on this issue of the scientifically proven versus scientifically unproven, but perhaps unable to prove? So do you use methods that are not scientifically proven, but you think might work anyway? Or do you think that you should not be using this kind of methods?
So my first part of the answer is, first use the so-called proven, if there is anything proven, being honest.
Yeah.
But first use those which has some strong scientific background, and we know what to expect using them.
If possible, right? Because sometimes perhaps it's not
possible.
Yeah.
If possible. And this is evidence-based practice. And then you can add as a not alternative but comprehensive, add some other things which fulfill the treatment. And very often it looks differently. Okay, so people are using those not known things first.
What kind of not scientifically proven things do you use in your work?
I think I use a lot of micro-invasive things, like invasive physiotherapy, which is not strongly proven.
Like
it has a lot of scientific foundation, but it's not proven. Okay. But I don't use a lot of them.
But like what do you mean? Like needling or something else?
Yeah, everything which uses some kind of needling. Yeah.
Okay. So when you break the skin barrier, yes,
yeah,
that's the distinction.
Yeah.
Okay, and I wanted to ask you whether you know how can I notice if my physiotherapist is a charlatan? So if he doesn't really follow those guidelines that he should be following, what should I do, and how can I know if he's okay or if he's not okay?
Very good question. And my answer will be very sad. Unfortunately, our let's call it legislative body, so Krajowa Izba Fizjoterapeutów, KIF, has not made guidelines, general, some kind of code of conduct
It doesn't exist. There is no such thing as a code of conduct.
And that's the problem.
Mm-hmm.
So there is no place where you can go and read how should it look like.
So each physiotherapist sort of invents his own way how he wants to treat his patients.
Unfortunately, yes.
Okay. What do you think can be done to change it?
Construct and make a code of conduct.
And then, so if I visit my physiotherapist, what are some signs that his conduct is not perhaps the most ethical or the most right?
If she doesn't listen to you or listen very shortly, doesn't make interviewing, doesn't make a lot of assessment, and have very fast solutions. And very often, if the more shocking solution is for you, the more probable it's bullshit.
Okay. Then I want to also ask you, because now osteopathy has become very popular, and many people say that it's charlatans who do physiotherapy, but there is some evidence that it might actually work. What do you think? I'm not sure whether you have finished the osteopathy school or not, so perhaps you could elaborate on that also. Tell me about your own experience and your perspective on osteopathy.
Okay. I was learning osteopathy for a long time. I was a co-founder and director of one of the osteopathic schools in Poland. So I've been there. And in my opinion, is again very personally driven. I think there are great specialists who are physios and osteopaths, but it is that because they are very critical. And many, unfortunately, the idea, the concept, the philosophy is full of crap. And that has to be told, okay? And it's not my opinion. It is what comes from evidence and literature. So if osteopathy wants to become, in Europe, in Poland, become a medical profession, it is not. It is very important. It has to start trying to evidence what they are doing. And very often, they are not doing that.
Could you perhaps explain for those who might not know what's the difference between osteopathy and physiotherapy in like a daily practice?
We are based on different foundation why we are doing something. It's everywhere. Being honest, it's everywhere. Okay, between medicine, because physiotherapy is medicine, Western allopathic medicine. Okay. Eastern or Chinese medicine, osteopathy, chiropractics, and so on, so on, so on, so on. So we are based on different foundation, why we are doing something. And the problem with many unconventional methods, it is that they are trying to catch some phenomenon, some interesting thing, or unproven but sounds really fantastic process or phenomenon, and they are building a whole world around it. Okay. From my perspective, it's not holistic. It's so simplistic that it's stupid.
Okay? Osteopathy?
Also somehow.
You mean osteopathy is not holistic, but really simple?
Being honest, yes. Because if you look at it, how they provide the treatments, they are very, 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 very similar all the time.
Okay. For example, because I've never been to an osteopath.
So go and look
explore.
How it looks like.
Okay.
What I want to underline here, I think osteopaths are welcome and they are needed, because there are people which will feel better if there is no serious pathology. Osteopathy can help them, and in some of those people only osteopathy will help them, but not because osteopathy is so great. It is because those people believe that the osteopathy is the best, and that's fine.
Okay, because there are no scientific studies that would show that osteopathy works. And from your knowledge, your medical knowledge,
I don't want to say there are no. Mm-hmm. That would be really unfair.
Mm-hmm.
I think there are many things which we are doing almost the same in physiotherapy and osteopathy. The problem with osteopathy is that they are taking too much. They are trying to look into, for example, primary lesions and things like this. So going very, very deeply and trying to assess something which they cannot assess. They don't have tools for that. Those tools are not sensitive enough. Mm-hmm. Those tools are not specific enough. So, but they are not looking into that. Okay? When you take 10 great osteopaths, okay? Physiotherapy is the same. It's important. But if you take those 20 therapists and you ask them to palpate, to find something by palpation, okay? You know what the differences will be?
No. What?
Huge. And nobody will be right.
Okay.
Now, that's not the problem. This is how it looks like. Now, the problem is, how do you concern it? So what I mean, how do you deal with it?
Yeah, how do you solve this problem?
Yeah, exactly. So I use palpation, being very looking for a word.
Cautious.
Being cautious, to do not overthink it. Because if you want to find something, you will find it. Okay? So that's the first thing. And I do not take it very seriously for differential diagnosis, for clinical reasoning. It's a part of it, not all of it. And osteopathy is very, very much based on palpation. Okay. That's one of my problems there. Okay. Another problems are those they are again trying to combine things which we do not know if they even exist. Okay.
Like what?
Connections. I mean connections.
Okay, connections between some parts in my body. They say that they exist, but they do not.
Let it be like this.
Okay.
Yeah.
Let's see. So
if they are there, last thing, if they are there, it doesn't prove that the treatment is effective.
Okay. And so when did you resign? When did you notice that it's not what you want to do?
After 5-6 years being there.
So you took, you did the school, yes? You did like 5 or 6 years of osteopathy, and then after
4 years of the school, the 4.5 maybe, I don't remember well, something around it. It was 2000, I don't know, 12, maybe 13. Yeah. We had problems inside the company. That's one thing. And another thing is I saw, but my main problem was from ethical point of view. I saw it's mainly business, not treating people, not looking for the real answer.
Okay, so I'm amazed that it's so popular, because we can see more and more osteopathic centers being opened, even though you say that it might not work.
It is different. It is easier to promote. Because physiotherapy is massaging, okay? It's massage, okay? You do squats and then massage.
Yeah, and that's what
osteopathy is so magic. It's easier to promote if you are different. Look into Instagram, Okay, sorry, I'm mentioning the social media.
Yeah,
but
no, it's okay.
it's not a problem. Okay.
Yeah.
So look into any stories anywhere. Okay. I always say that my physiotherapy and my kinesiotherapy, so treating by exercises, it's, being honest, dumb. I mean,
Yeah, it's not spectacular.
it's not for stories on Instagram.
Yeah.
Okay. You have to be different. You have to be better. You have to be wow. It has to be sexy and cool and all of the words you young people are using now that will make you be there and somebody will share it. Wow, it's great. Okay. This is very far from the process of treatment.
Also, we very often want instant results, right? Also, it's in the social media era that we want just like do one thing and then have the end result. And so like just with physiotherapy, it probably won't work. You have to really spend the time, do some quite boring exercises every day for 6 months. And maybe you will see, like probably you will see the effect.
Like with training, nobody thinks that in sports you will get to gold medalists in 1 year.
Yeah.
Yeah. Suddenly in health, you try to get there in 4 weeks.
Yeah. So it's important to underline that. So I'm glad that we've mentioned it, that systematical work and work that might be a bit boring might actually give you the results, and that it's not only the spectacular wow magic effects that you should be after.
They are okay. People, let's use it, but do not put all of the trust there, please.
Okay.
Yeah.
And tell me, what do you think are the perspectives of physiotherapy in various directions, you might say? So first, for example, what do you think physiotherapy will be like? Do you think it will be more evidence-based in, let's say, 10 or 20 years from now? How do you think, for example, technology might impact your work as a physiotherapist? And also, what do you think about the new versions of physiotherapy? Like, I know that there are some physiotherapists that say that they are neurophysiotherapists, or that they also work with your psychology. So what do you think about those trends?
Oh my God. Okay. So if somebody, I will start from the last one.
Yeah.
If somebody did the psychological studies, so she is educated, that's fine. He can combine physiotherapy and psychology and psychotherapy, for example. If you're not, fuck off.
Okay.
That's my answer.
Yeah.
Sorry for the words.
Yeah, but I think
they had to be like this.
The regulations are most important, right? Like, as long as we don't have the regulations that would protect us.
It has to be there because the trauma can be it can be so much terrible from the physical perspective, physiotherapist, from the psychological perspective. So you can make somebody a huge trauma with wrong process.
Yeah.
And some people don't understand that.
But as a concept, do you think that it might be interesting?
It might be, but it would take 11, 12 years of study.
Maybe it would be interesting in a cooperation where a physiotherapist would cooperate.
This is where we should go. This is where we should go. You cannot be a specialist in everything. Okay? So I stand for teams like medical doctor, physiotherapist, psychologist or psychotherapist. I don't want to put them anywhere, okay? So somebody who works with your psychological aspect or psychosocial aspect, okay? There should be also pharmacists, because very often pharmacists know much more than a doctor can know about drugs, okay? Yep. So it is about the team, not the person themselves who is a hero. It is a team which will treat a patient. This is where I look in. This is how I look on physiotherapy now. We should. You ask. It will in 20 years. Will it be more evidenced? Yes, it will, because we will have more evidence. Depends what kind of what quality evidence will be, but we will have it more. But how we will use it, that's the thing. Okay, we already have a lot of evidence. Are we using it well? No, we are not. I think we have to specialize. Okay, I don't think you can be a physiotherapist for everybody, for any kind of problem. We have to specialize directionally. So I mean, musculoskeletal, okay, neurologic, pediatric, urogynecologic, and so on, so on, so on. Because the knowledge which is coming out, there is more and more and more, and you cannot follow everything. And I think the same is in psychology. You cannot follow everything about all kind of problems, psychological problems. You will specialize in some kind of them. Am I right?
Yes, I think so. But then also in psychology, if you, for example, are a therapist, then there is also a wide variety of therapeutic schools that you might follow. And then if you're a patient, then you can also choose. So I'd say it's probably a bit different because it's up to you in the end.
That's it. And this is fine. And this is fine. The problem is that somebody is claiming is better.
Yeah.
That's the problem. Okay?
Yes.
And he's doing that publicly. I'm better. Yeah, show me, prove it. I'm saying I'm better. Okay. This is not medicine.
Yeah. And then what do you think about technology in physiotherapy?
I think, good question. I think I will die and physiotherapists will be still working with patients.
Yeah. I mean, you're safe. Your job is safe. It won't.
Yeah, I think so. Yours too.
Intelligence.
Why? Because there is too much humanity in our job. It is how we talk. Okay? AI can talk already. That's fine. Can it touch like we are touching? Can it or does it combine all of those things? And how this technology and AI, I don't know, okay, can be a person and has a personality, and how much the patient will believe that.
But do you think that you might use some tools of artificial intelligence in diagnosis, for example? Or...
I think yes. This is what we have to start using.
Or, for example, in gathering the evidence that you're talking about, do you think that perhaps?
And I'm already using some tools to look for evidence and to manage and assess evidence. I already use those tools, but they are very basic.
What are you using?
I will tell you the list of it. Maybe people can. Do you see me still?
Yep.
Yeah. So, for example, Research Rabbit. That's one of my favorite one. Elicit.
Okay.
Site. Lead maps.
I know.
Those are main ones.
Yeah.
They are very basic, but they're helping me. I don't have to, if I do a scoping review or scoping research, they're really, really fantastic. And Elicit is really good, the paid one, when you want to go through the many randomized clinical trials and you want to get the data out of it.
And also in the beginning, when you've explained to me what do you mean by evidence and how does evidence physiotherapy work, you've mentioned a lot of different parameters. Do you think that it might be possible to create a model that would synthesize all that information that you've mentioned? Or do you think it's way too complex and that the human factor is really important in finally like combining all those different parts?
I'm too small and too short to answer this question.
Okay.
I'm just a physiotherapist.
Mm-hmm.
So I think this question is to people who work with AI and work with those things.
Mm-hmm.
I think technology will be there. I just see that I don't see a huge jump yet.
Mm-hmm.
I don't see it. Maybe there is something, I don't know.
Okay.
But for sure, there are many things like this. But I don't see yet a big jump. Okay? I see a lot of engineering. That's fine. But it's not making this huge difference yet.
Mm-hmm. Yeah. For you, it just means you will have more patients to cure because...
Unfortunately, yes.
Yeah. Because you will just use screens more and move less.
Look. Even if we have so much better research, so much better science, so much better technology and so on, we still are more and more unhealthy as a society. The numbers are rising, not falling down.
Unfortunately.
Why?
I don't know why. I hope that this will change. I'm like, maybe if someone listens to us, he will decide to make a change in his life and to become a bit more healthy. We'll see. Okay, well, thank you very much for the conversation.
Yeah, you too.
I learned a lot, so thank you very much. And I wish you a very good end of this year and a happy new year.
Thank you.
And a lot of success in your work and other things.
You too. You too. Thank you for inviting me. I'm sorry, everybody, for my English. I was just cutting you with it.
It was perfect.
I'm sorry, and I wish you all of the best for the coming year.
Thank you.
And thank you for invitation. That was a pleasure to meet you.
Great. Bye.
Bye-bye.